my troubles seem to haunt me, you uncover the truth. 'Cause nothing really matters when you see it from a distance, yeah, yeah. 'Cause I'm up higher than planes could take me. I have acquired everything I need. You set me off into emotion, oh yeah, where I can just be free. You give a little, but you're giving me just what I need. No time for riddles, you're in the middle of my self-release. You have unchained me, you haven't, yeah, you have unchained me, you haven't, oh yeah, yeah. I don't spend time thinking about what could go wrong. I deal with them one at a time. I'm holding my head up. You give a little, but you're giving me just what I need. No time for riddles, you're in the middle of my self-release. 'Cause you have unchained me, you haven't, yeah, you have unchained me, you haven't, yeah, you have, yeah, say you have unchained me, you have unchained me.
Well, good evening, everyone. My name is Jim Merrill. I'm the managing shareholder for the Bernstein Scher Law Firm in Manchester. It's my honor to serve as co-chairman of the Distinguished Industry Award Ceremony. In fact, it's been my honor to serve as chairman of the Distinguished Citizen Award Ceremony twice previously. But this year, the Daniel Webster Council decided to do something different. For the first time in nearly 50 years, they decided to honor an entire industry, New Hampshire's hospitals and our healthcare heroes working there. I've been a scout and an assistant scoutmaster, and I'm fortunate to be able to work with hospitals in our state as well. So it's a real treat for me to serve both organizations tonight. On behalf of over 6,500 youth, 5,000 that are scouts, and 2,000 adult volunteers and the staff of the Daniel Webster Council, I want to express a heartfelt thank you for watching our live virtual event tonight. We recognize and celebrate this evening all of the New Hampshire hospitals and healthcare heroes who exemplify scouting's values and principles in everyday life, and for whom all of us are truly grateful every day. With that in mind, I want to take a moment to welcome our 2021 co-chair, Steve Annan, president of the New Hampshire Hospital Association and active parent of Bedford Troop 5. Unfortunately, Kevin Donovan, New Hampshire Hospital Association board chair, was unable to be with us tonight due to responding to COVID-19 at his hospital. Also joining Steve is Jay Gary, Scout Executive and CEO of the Daniel Webster Council, Boy Scouts of America. Steve.
Thanks, Jim. Tonight's program provides an opportunity to put a spotlight on New Hampshire hospitals, their amazing healthcare heroes, and the girls and boys of scouting in New Hampshire. I'm sure you'll learn something new about scouting this evening, even if you're already involved as a parent or volunteer. One of scouting's strengths is that it sets high expectations for young people and provides opportunities for them to test their comfort zones, and accordingly, we've asked some scouts to be part of our program tonight. In a moment, scouts from Bedford Troop 5 will present the flags and lead the Pledge of Allegiance. Please stand for this pre-recorded presentation from the Daniel Webster Council, Camp Carpenter, for the presentation of the colors, and remain standing for the Pledge of Allegiance and the National Anthem.
Color Guard, please present the colors. Scout salute. I pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Ready, two. Color Guard, please present the colors. Scout salute. Ready, do.
Thank you, Bedford Troop 5. Over the course of 1 hour tonight, you'll hear about the remarkable work New Hampshire's hospitals and their dedicated teams have done for our state over the past year and a half, and how they continue to support us during this critical time. You'll also hear about scouting in New Hampshire and how it's adapted during the COVID-19 pandemic, and it's thriving statewide. Now, we're fortunate to be able to hear from some of New Hampshire's elected leaders who have some special words for us tonight. We'll hear videos from all of these leaders, and we'll start with a message from Governor Chris Sununu.
Hi, this is Governor Chris Sununu. The Boy Scouts absolutely got it right this year by recognizing New Hampshire hospitals and their employees as the Distinguished Industry of the Year. The men and women who serve in New Hampshire hospitals, they've been on the front lines of this pandemic for the past 18 months. And whether it's been assisting to vaccinate Granite Staters, caring for those with COVID, or just keeping up with patients' day-to-day needs, these individuals, they've gone above and beyond time and time again. There's no question, these have been challenging times to work in the healthcare industry. To those who have stepped up to answer the call and work in that healthcare community, we can't thank you enough. To the Boy Scouts, thank you for recognizing New Hampshire hospitals as your Distinguished Industry of the Year. Thank you all for everything that you do in support of New Hampshire communities. Please keep up the great work.
Thank you, Governor Sununu. We appreciate those words. Now we'll hear from U.S. Senator Jeanne Shaheen.
Good evening. I'm Senator Jeanne Shaheen, and I wish I could be there in person with all of you to celebrate New Hampshire's hospitals and healthcare heroes. I want to thank the Daniel Webster Council of the Boy Scouts of America for honoring the healthcare industry as this year's Distinguished Citizen Award. I can't think of a more deserving group of individuals to receive this honor. It's been nearly 2 years since our world was turned upside down by the COVID-19 crisis. Since the pandemic hit, we've lost more than 760,000 Americans, including 1,600 right here in New Hampshire. And those aren't just numbers. Those are lives, families, and communities are forever changed by the loss of our fellow Americans and Granite Staters. Our healthcare workers have been at the center of this crisis, fighting every day to keep our communities safe. Many have taken on extra shifts to help meet the demand, and all have risked their own health to care for others. I'm grateful for the sacrifices and selflessness of these individuals. I also want to recognize the Daniel Webster Council of the Boy Scouts of America for their leadership in the Scout Support Hospitals Initiative. Scouts have collected care packages to donate to healthcare workers. Thank you for leading these efforts. Lastly, I want to thank the New Hampshire Hospital Association for their continued advocacy of our healthcare workers and for their leadership in tonight's event. Congratulations again to New Hampshire's hospitals and healthcare heroes.
Oh, thank you so much, Senator Sheen. We really appreciate that. Now we'll hear from U.S. Senator Maggie Hassan.
Hello, I'm Senator Maggie Hassan. Thank you to the Daniel Webster Council of the Boy Scouts of America for hosting this virtual event to honor the contributions of all of New Hampshire's hospitals and healthcare heroes. We can't thank healthcare workers enough for what you do every day, and that's been especially true throughout the pandemic. You've done incredible work to keep Granite Staters safe and healthy, putting your own health at risk at times. During an incredibly stressful and unprecedented time, you've acted with bravery, professionalism, and kindness. Our state and our entire country owes you our thanks and our appreciation, and I'm really grateful to the Scouts for honoring your extraordinary efforts. Thank you again for all that you've done and will continue to do. And please, everybody, stay safe.
Thank you so much, Senator Hassan. We so appreciate your kind words. Now we'll hear from Congresswoman Ann McLean Custer.
Good evening. I so wish I could be with you in person to celebrate this year's New Hampshire Distinguished Industry Award, presented by the Boy Scouts of America's Daniel Webster Council. This year's award recipient is a little different from previous years. Instead of one individual, this year's honoree is an entire industry. In recognition of the COVID-19 pandemic, it's clear that there's one industry that's gone above and beyond, risking their lives and putting the needs of others in front of their own. I'm honored to thank our healthcare workers and hospitals for their dedication and commitment to caring for patients and their families on the front lines during this unprecedented time. While there's no way to adequately thank you for all that you have done, please know that I will continue to be a champion for the Granite States healthcare providers, our rural healthcare systems, our hospitals, community health centers, and home health services through my work as your representative in the United States Congress. On behalf of New Hampshire's 2nd Congressional District, I want to thank you. We are forever grateful to you.
Thank you so much, Congresswoman Custer. We appreciate those words. And now we'll hear from Congressman Chris Pappas.
Hi, everyone. I'm Congressman Chris Pappas, and it's an honor to be joining the Daniel Webster Council of the Boy Scouts of America virtually this year to pay tribute to New Hampshire hospitals and our healthcare heroes. Each year, the Scouts name a distinguished citizen to honor for their good work in our state and our communities. And while this year is a little different, you've chosen a fitting honor for New Hampshire's hospitals and all of our healthcare heroes for the brave and tireless work they've done over the last 19 months on the front lines of the COVID-19 pandemic. I couldn't think of a better group of Granite Staters to honor with this recognition. Our hospitals and healthcare heroes have done everything we've asked of them and more, as the work to keep our families and communities and all of us safe has been so significant, and we owe them all a tremendous debt of gratitude. That's why in Congress, I've worked to ensure that our hospitals and our healthcare workers have the resources and support they need to do this work. So thanks once again to the Daniel Webster Council of the Boy Scouts of America for choosing this group to honor, and for the work that you all do to make our communities a better place for everyone. Everyone stay safe and have a great holiday season. Thank you.
Wow, what a great group of special leaders sharing messages for tonight's event. We truly have some amazing frontline staff working tirelessly to move us through the pandemic. Next up, we have a video from Dr. Peter Rowe. Not only is he a Scout leader, but a physician as well.
Welcome to all of you who are able to come here tonight for this virtual event. My name is Peter Rowe, and many of you already know me as an emergency physician. Not many of you know that I'm also a Scout. As a Scout, it is my pleasure to serve as the Scoutmaster of Troop 6, my privilege to be the medical director for the Daniel Webster Council, and it is my honor to be here tonight to help recognize you, my colleagues, for your contributions to the Granite State. I am proud to be here both as a Scout and as a healthcare provider. Scouts are taught that what it means to be a Scout is embodied in the Scout Oath and Law. These two creeds contain many principles, but only one principle is so important that it appears in both. That principle is helping. The Scout Oath tells us to help other people at all times, and the Scout Law reminds us to be helpful. We've been through a lot over the last year and a half of this pandemic. It has been truly brutal. but it could have been a lot worse were it not for your help. Healthcare throughout the Granite State and the nation have rallied like never before to seek new therapies, to learn new care modalities, to develop innovative ways to overcome shortages, and to repurpose equipment to better meet everyone's needs. In doing this, you have invented new ways to help. In a world with ever-increasing healthcare demands, you have given of your time as never before, sometimes to the exclusion of your families. Courtesy of COVID, you have accepted new risks as just another part of the job. You have saved the lives of people who were not expected to survive, and you have comforted patients whose families could not be with them. Through all your efforts, you have taken helping to a new level. Sometimes you might not fully appreciate the impact you have. Your help brings us all hope. You bring hope of recovery to patients and families, and you bring hope to our state, this nation, and the world that someday things will go back to normal. You help us cope. So tonight, as Scouts, we gather to remind you how much we appreciate the help you have given us. Because of your help, families that would be broken are whole. Patients that might have died have survived. Because of your help, we all have hope for the future. Thank you for your help.
Dr. Rowe, thank you so much for those inspirational words. You are indeed an exceptional scouter, and we appreciate all your work in healthcare as well. The mission of the Daniel Webster Council Boy Scouts of America is to prepare young girls and boys to make ethical choices so they can develop into our leaders of tomorrow. It is my distinct pleasure to welcome one of our Scout heroes, Sam, who was awarded the Life-Saving and Meritorious Action Award in July of 2020 from the Daniel Webster Council. Sam didn't hesitate to act when his younger brother was choking. He stepped into action with the skills he learned from the Scouts and performed the Heimlich maneuver, saving his brother's life. Welcome, Sam Durso, and his Scoutmaster Justin Steichen from Bedford Troop 1776.
Thank you. Scouting has been a big part of my life ever since I joined Cub Scouts. I earned my Arrow of Light in 5th grade and I crossed over into Boy Scouts. From then on, Scouting has had a great influence on my life as I strive to live by the Scout Law and the Scout Oath. The Scouting program provides an excellent platform for kids aged 11 through 18 who want to be successful teenagers and strong young adults. The skills I've learned through Scouting have greatly benefited me throughout my life so far and have helped me follow the Boy Scout motto, be prepared. While I was not expecting what would have happened that summer night, I was prepared. I was in the kitchen with my mom and younger brother when I heard the strange muffled yelps of my brother from across the room. I looked over for a quick second, confused at what my brother was doing, but I turned around and continued watching what I was cooking on the stove. I heard my brother slap the counter a few times, so I turned back around and looked in his direction. His cries grew louder in volume as my brother began to look scared and desperate. I immediately knew what was happening and ran towards Bryson. Using a skill I had learned from Mr. Hickey's exceptional first aid training and Mr. Prendable's meaningful reinforcement, I was able to save my brother. I walked behind him as he was sitting on the stool and balled my fist and prepared to give the Heimlich. I gave one strong thrust and nothing happened. The next one was much stronger. I put all I had into it. This time, a ball of cheese and other ingredients from a dip he was eating, along with chewed up chips, shot out of his mouth. In the end, my brother was fine, and his life was saved because of the useful skills anyone can learn from Scouting. Scouts has given me both the knowledge to know how to react in the situation, as well as the confidence I needed to jump into action without hesitation. It is important for the people in the program, for the people in the community to support the program and get involved in Scouting. Not only so more people are potentially prepared to help in a situation like this, but also because Scouts is very helpful in the community and creates a great social environment for kids who want to succeed. Thank you. I also want to give a quick thank you to my Scoutmaster, Mr. Steichen, for helping me along this way.
Great job.
Thanks.
Thank you, Sam. What a shining example of the benefits of scouting and quite literally how it can change and save a life. Speaking of change, tonight we're announcing the new Healthcare Professions Merit Badge. The new badge replaces the Medicine Merit Badge. With the vast and vital universe of healthcare, there are so many workers that keep us healthy and happy. In fact, these professionals that work in a field so vast that calling it medicine simply doesn't work. That's why the Boy Scouts of America is introducing the Healthcare Professions Merit Badge, a STEM-focused, career-oriented badge designed to introduce young people to the roles that health professionals play in the delivery of healthcare. The first class has already started to form, and we look forward to seeing more young people discover what healthcare roles interest them. Now I would like to introduce Bianca Cullen, Development Director for the Daniel Webster Council, Boy Scouts of America. Bianca?
Thank you, Jay. Good evening, and thank you for joining us tonight for a very special evening to honor New Hampshire hospitals and their healthcare heroes. We were able to get a glimpse of the amazing work our staff, volunteers, and board members do each day to promote scouting in New Hampshire. We all have our why, and for me, the mission of scouting is to build a better tomorrow and to encourage young people to be the leaders they're meant to be. Everything that we do at the Daniel Webster Council is possible because of community supporters. Please bring out your phone. It's time in the program where I need you to take action. Now is the time. Text Help Scouts to 71777. Your donations are going to help Scouts right here in New Hampshire. Thank you and good night.
Thank you, Bianca. Welcome, friends. I would like to personally thank you for joining us this evening. I have such a deep appreciation for all of our healthcare workers and all of the staff that support our New Hampshire hospitals. Our communities are better because of your dedication. The Daniel Webster Council was incorporated in 1929 to organize, promote, and support scouting here in the Granite State, and it's a responsibility we take seriously. The mission of the Boy Scouts of America is profound: to prepare young people to make ethical and moral choices over their lifetimes by instilling in them the values of the Scout Oath and Law. While quite a bit has changed since the Boy Scouts of America was founded in 1910, the Scout Oath and Law remain central to who we are. Our Scouts and volunteers are truly amazing, as you saw in the examples of Sam and his Scoutmaster Justin, and also in Dr. Rowe. It is people like them that dedicate an incredible amount of time to serve others. Here are just a few highlights of our service. In the early days of the COVID-19 pandemic, Scouts across the state collected much-needed PPE, snacks, and other care package supplies, along with thank you notes to support and recognize our healthcare heroes at their local hospitals. More than 30 scouting packs, troops, and crews coordinated the collection of 12,750 items to be distributed in care packages to the hospitals during the pandemic. In November of this year, Scouts supported their local communities to collect non-perishable items in a campaign known as Scouting for Food. A total of 3,200 Scouts and volunteers coordinated the drive statewide and donated food to local pantries. Over 171,500 items were collected in the effort. It's worth mentioning that a total of 11,560 volunteer hours were accumulated by this annual campaign. That's quite an achievement. And lastly, despite the challenges of the pandemic, we've had 288 Scouts earn the Eagle Scout rank in 2020 and 2021 thus far. The average number of hours for an Eagle Service project are about 150 volunteer hours. That's more than 43,200 hours of volunteer service given to the community in just Eagle Scout projects alone. This doesn't even include all of the additional hours our Scouts and adults and parents give through their effort to continue their rank advancement up to the Eagle. Needless to say, there are so many great ways we can help others. And on behalf of the Daniel Webster Council and our youth and adult volunteers, I'd like to personally thank this year's sponsors who have helped us recognize an industry so worthy of distinction. Their support tonight is essential to sustaining Scouting's programs and the service we provide to others throughout our state so that we may continue to support Scouting for Food and the New Hampshire Scouts Supports Hospitals initiative. Their support provides New Hampshire Scouts with healthy, fun, and confidence-building adventure that instills values, helps Scouts lead for the benefit of others, and provides for a program that will introduce them to career opportunities such as healthcare. That will change our community for the better. We would like to thank the following sponsors. At the medicine level sponsor, St. Mary's Bank. TD Bank Institutional Healthcare Services. Our public health sponsors, New Hampshire Hospital Association, Anthem Blue Cross Blue Shield, Bank of New Hampshire, Holland and Knight. Our safety sponsors, Catholic Medical Center, Elliott Health System, Bank of America, Bernstein Sure Group, and of course our ad sponsors, Steiner Law, Rath Young and Pignatelli, Brady Sullivan, 2 International, Spear Memorial Hospital, Darcy Creative, Delta Dental, Littleton Regional Healthcare, Harvard Pilgrim Healthcare, Monadnock Community Hospital, and McLean Middleton Law Firm. Some additional sponsors in Scouting are Adored Wi-Fi, Good Feet, and Anagnost Companies. We would also like to thank our friends here at Studio Lab. Thank you for supporting the Daniel Webster Council. Tonight would not be possible without the guidance and support. Now I would like to introduce you to our first sponsor video from St. Mary's Bank.
Hi, my name is Ron Covey. I'm CEO of St. Mary's Bank, and we're honored to support New Hampshire hospitals and healthcare heroes. I want to personally thank you for your dedication and all you do to support our community's healthcare each and every day.
Thank you, Ron. We so appreciate your support and your kind words tonight. So now we're going to hear from a few hospitals. This first video is from Spear Memorial Hospital in Plymouth, New Hampshire.
My name is Travis Boucher, and I'm the Chief Financial Officer here at Spear Memorial Hospital. On behalf of the team here at Spear, we wanted to thank you for your generosity. The masks were an example of something that was greatly needed when the supply of things like that were unprecedented. We were scrounging everywhere so that we could ensure that our patients were protected, our staff were protected, and our visitors were protected. So as you can imagine, getting a gift of masks was well taken, and we used them all up. We also want to thank you for the baskets that we received. The clinical team members really appreciated them and took advantage of the nice treats that you put in there. So at the end of the day, we really did want to take the time and say thank you. We continue to experience today the fight against COVID-19. As we film this, our organization, our bed capacity is full. But it's really the generosity, it's the support of our community that keeps us here and keeps us going. So thank you.
Thank you so much, Travis. We appreciate that. Now we'll hear from Wentworth Douglas Hospital in Dover, New Hampshire.
Sheila, so we just want to talk about, obviously the hospital's been impacted by COVID-19. How does it feel that organizations like the Boy Scouts step up to kind of help out during an unprecedented time like this?
Well, Charisse, it's really special to have an organization like the Boy Scouts reach out to the staff at Wentworth Douglas during this time really means a lot. They're an extraordinary organization, and to know that they're thinking about the staff here who are dealing with so many challenges and being here to support us and help us and lift our spirits has been great. Many of our staff have children who are in Scouts, so it really means a lot to them to know that their children are thinking about them in their professional world. And so at Wentworth Douglas, we want to say thank you to all of you who've done this for us, and keep up the great work.
Thank you, Sheila. We so appreciate that. Now we'll hear from Monadnock Community Hospital in Peterborough, New Hampshire.
Hi, I'm Laura.
And I'm Phil.
We're here from Monadnock Community Hospital in Peterborough, New Hampshire.
We just want to start out by thanking you, the Scouts here in New Hampshire, for all the ways that you've helped out healthcare professionals across the state, especially during the pandemic. Laura and I were talking earlier, and we were reflecting on how much the 12 rules of scouting are things that we actually look for here in the hospital and are really important in people who care for others.
And we see from our nurses and our doctors and our technicians every day these qualities. They are trustworthy and loyal, and they, like you, have worked so hard during this pandemic.
Not only that, but now more than ever, it's also important for these people, and ourselves included, to be friendly and courteous, because everyone appreciates it when people treat us that way. So we strive to do that with others as well.
And probably most importantly, brave. We have seen so many times this past year when our caregivers set aside their own personal well-being and take on risk because they're thinking about their patients first.
You know, we tell each other that we can do this every day, and we want to encourage you the same. Keep on being a good scout and learning these important qualities, because they're going to take you far and they're needed.
And we couldn't have gotten through this past year without the help from all of you. So again, thank you for being scouts. The world needs more of you.
Thank you so much, Laura and Phil. We so appreciate your kind words. Now we'll hear from Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire.
Hi, I'm Dr. Michael Calderwood, Chief Quality Officer at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. COVID has truly challenged the healthcare system, both here in northern New England and across the United States of America. But it has also shown the strength of community and the power of service as we have come together in an effort to battle this common enemy. I'd like to personally thank the members of the Daniel Webster Council for their efforts in supporting local healthcare systems, and specifically for fabricating and delivering personal protective equipment that was critical in keeping frontline healthcare workers safe as they cared for those most impacted by this global pandemic. As is said in the Scout Oath, you truly have helped other people. And as an Eagle Scout, I want to personally thank you for all that you have done and to say that it has made a difference. Thank you.
Thank you, Dr. Calderwood. So very much appreciate that. Hearing from an Eagle Scout as well. Now we'll hear from Parkland Medical Center in Derry, New Hampshire.
Hi, I'm John Skevington, CEO at Parkland Medical Center in Derry, New Hampshire. I want to say thank you to the Daniel Webster Council for recognizing healthcare and hospitals as the Industry Award Winner of the Year. It's a special recognition that we're very proud of. And throughout the pandemic, we have received so much support from our scouts locally, like Troop 9 out of Atkinson, who delivered care packages for our staff, and other troops around the area who have written encouraging messages for our staff. It's made a tremendous impact overall. And as I think about everything that we've been through throughout the pandemic and what our staff has done, there are many examples of how our own staff have exemplified many of the Scouts' laws. But one of those that comes to mind is being kind. And a great example of that is we actually had an employee whose family members were unvaccinated and need to be hospitalized. And we didn't realize this till after they had been safely discharged, but they were very nervous about their unvaccinated status. They were worried about whether or not they would receive a stigma when they came into the hospital. And as it was relayed to us afterwards, they were just blown away by how kind and courteous our staff were, regardless of their vaccination status. They treated them as individuals and took care of what they needed to get them home safely. So once again, thank you to the Daniel Webster Council. Thank you to all of our staff here at Parkland Medical Center for everything that you've done over the last 20 months. Thank you.
Thank you so much, John. We appreciate that. Now I would like to welcome back Jay Gary and Sam Durso.
The Daniel Webster leadership and local scouts will be hitting the road after this event to present each hospital with their award. Be sure to follow up on Facebook, Twitter, and LinkedIn to see the roadshow photos. Tonight, we would like to honor the work of the New Hampshire Hospital Association for their leadership and guidance throughout the pandemic.
Thank you. Thank you, Sam.
Welcome. Well,
thank you. Thank you so much. On behalf of the New Hampshire Hospital Association, our Board of Trustees, member hospitals, and the tens of thousands of healthcare workers, many of whom are caring for patients right now, I am proud to accept this Distinguished Industry Award from the Daniel Webster Council of the Boy Scouts of America. Our hospitals and the caregivers and others who staff our institutions have been through so much over the past 20 months, and in some ways, the most challenging days are ahead. But tonight's celebration is a welcome moment to pause and reflect on all that those on the front lines have done and continue to do. Their commitment to their patients is truly inspiring, and it is my privilege to stand before you tonight to accept this honor on their behalf. When COVID-19 arrived at our doorstep on March 2nd of last year, there was so much we did not know about this novel coronavirus, but we did know the devastation it was wreaking overseas and what we were beginning to see on the West Coast. One of the overriding concerns then and now was whether we would have enough hospital beds to care for what we all feared would be an overwhelming surge of patients with COVID-19. The reaction was swift. In addition to lockdowns, stay-at-home orders, and more, hospitals across the country canceled all non-urgent elective procedures to preserve the personal protective equipment and hospital bed capacity to ensure they could serve patients with COVID-19. Hospitals in New Hampshire came together to partner with one another to ensure that every patient could get the care they needed, and they continue to do that today. Their commitment to one another is nothing short of extraordinary, and their commitment to the patients and communities who need them now more than ever before could not be more clear. And in many ways, tonight's recognition by the Daniel Webster Council of the Boy Scouts of America is a reflection of that community spirit. The Scouts have long sought to build community and future leaders who care for one another, their community, and themselves. Guided by the Scout Oath and Law, Scouts are taught the importance of service, to do their best and help other people at all times. Just as embedded in the communities as Scouts are, the blue and white H we see throughout our state represents the promise that hospitals hold out to their communities, that they will always be there. No matter what has happened, no matter who you are, no matter what you have in your wallet, your community hospital will always be there for you. Whether it's our largest academic medical center or large urban hospitals in the central, southern, and seacoast portions of our state, our specialty hospitals, or our smaller hospitals that serve the rural communities all across New Hampshire, New Hampshire's hospitals are here for you. They are leaders in medical innovation, conducting groundbreaking research and providing critical interventions that are saving lives. They are leaders who are actively engaged with others in their communities to improve health and health care for those they serve, often their most vulnerable citizens. They are leaders in serving the greater good, working with state and federal partners to serve the patients and communities who depend on them. They are compassionate, dedicated leaders who will always be there for you. That is why the current COVID-19 surge is so concerning. Those healthcare heroes I spoke about, they're all of those things and more, but they're tired. Even so, they continue to rush in to do what they were trained to do, to care for others. It's why we continue to plead for the public's help to stem this tide of COVID-19. Get vaccinated, wear a mask, avoid crowded places, wash your hands, stay home if you're not feeling well, and get a test if you're experiencing symptoms of COVID-19. We're all in this together, and if we can continue to do all of those things, we can make a difference. The women and men of our hospitals come to work every day with one goal in mind: to help other people, by easing their pain and suffering, by calming their fears, sharing in their joy when a new life is born, or sharing in their grief when a loved one passes away. And they do it with great care, compassion, and dedication like no one I've ever seen before. And they do it every single day. On behalf of the New Hampshire Hospital Association, our Board of Trustees, staff, hospital members, and the thousands of healthcare heroes across New Hampshire, I want to again thank the Daniel Webster Council of the Boy Scouts of America for this incredible honor. Now, I also want to thank everyone who has already made an investment in Scouting by sponsoring tonight's event or purchasing a Prepared for Life appreciation gift. There's still a limited supply of those appreciation gifts available to purchase, so please contact Bianca Cullen at development@nhscouting.org. And finally, you still have time to donate by texting Help Scouts to 71777. As we close tonight's event, I again want to thank our hospitals and healthcare heroes, our partners here at the Daniel Webster Council, Scouts all across New Hampshire, and our sponsors. Please enjoy this video from Troop 6 and a few photos from the Scout Support Hospitals Initiative. You don't want to miss it. Thanks so much.
Thank you to all healthcare workers. As the child of a doctor, I know how hard it can be going from day to day, and I'd like to thank you all for working so hard and protecting us.
Thank you from everyone in Troop 6G from all the sacrifices you make every day. We know how hard it is to constantly be on the front lines, risking your lives to help other people. Thank you so much for all your hard work and dedication.
Thank you so much for all you do. We really appreciate it.
Thank you for everything. Congratulations.
Thank you for everything you sacrificed and for making our community a much healthier and safer place.
Thank you, healthcare workers, for your intelligence and bravery. It's really helped us through COVID-19.
Thank you, healthcare workers, for going in the way of danger to save others and to save the public. This is what it means to be a true hero. Thank you for everything.
We are so grateful for your hard work and sacrifice, especially during a pandemic.
Thank you to all healthcare workers. We appreciate your hard work and support. We couldn't do it without you. Thank you.
Troop 6 wants to thank all nurses, physicians, and essential workers for helping in the front lines against the battle of COVID-19.
Thank you, healthcare workers!